Yeah, thank you very much, Joshua, for that really informative talk and for sharing your experiences. I'm going to turn it. I was going to ask you a question, but I think with the remaining time, I'll ask it last if we still have. But I don't want to take away from any of the audience, so I'll turn it over to Claire. Maybe she could just facilitate some of the questions that may come in through the chat, or if people raise their hand or somehow indicate by turning on their video if they wish to ask a question of Dr. Ellis.
So I do have a couple of questions here that have come in. So one here, if we take the implicit test and we unsurface a lot of implicit bias, how do you help eliminate them? Any resources?
I think the first thing is to identify it and just to self-reflect. And I don't mean identify and mope on and being a negative thing. I think anyone who grew up in American society is susceptible to biases. It doesn't make one person a bad person per se. And I have a belief that if I was use a dramatic phrase, but in Germany in the 1920s or 1930s, and I was blonde and blue-haired or blonde and blue-eyed and white, I would probably have engaged in the time period. And so what I would say is just be aware of it. And then secondly, there's a number of resources available that you can read into. But I'd encourage you to focus on some of the biases that would be relevant in Canadian society. And I think the fact that we unfortunately don't have a great access to our Native American population here, but as you guys demonstratively have, I'm sure there's a plethora of resources in which you can read stories of the Native American experience or any racial minority experience. Read more, listen, engage. Don't be ashamed, I'd say. I think that's the biggest highlight is in a safe setting. We're given a big, safe, comfortable environment to educate ourselves in most other categories, and this one should be another one.
Thanks. And then I believe, Guinevere, you have a question you wanted to ask?
Yeah, I just wanted to say thank you. That was a really fantastic talk. And definitely we have the same sort of things. I was living in Thunder Bay before, where we have a much larger Indigenous population, and certainly they have like their own sort of affirmative action with the med school there, and people really took issue with the fact that Indigenous students were prioritized and had sort of different entrance criteria. So it's really interesting. I sort of have a larger question. So when I have conversations with people about topics like this, there's a lot of people who sort of feel affronted. Like your first slides really resonated when I talk about discussing white fragility, like the book White Fragility, and then like using the concept of racism. And like you said, people just have a very guttural reaction. And I think a lot of people take issue and they sort of disengage and don't feel comfortable. And I know that there's the other side of that, which is that people shouldn't feel comfortable, to have self-reflection. But at the same time, when I've had conversations with people about this, even Netflix obviously making a concerted effort to diversify and have biracial, and have Black leads and things like that. It's just people get very affronted by the racism terms. So I'm just curious kind of what your take on that is. And also just my other question is, so I gave a talk on the social determinants of health and lymphoma, and I was talking again about race being a social construct, and then everyone sort of said, well, why are we still talking about this? But then there's the flip side of that where we need to talk about race. So I'm just sort of wondering where you think that fits into the literature, if you're accounting for all these other variables like economic status and things like that. Sorry, that's a lot of questions.
No, that's great. And so your first question is I often get this question when I give it to this talk to undergraduate students, and it specifically looks at affirmative action. And it's such a passionate subject here in the United States, and it's primarily because, I'll back up a bit. I would say if you're going to do this and try and keep everyone at the table, my style is to do it in a non-accusatory approach. And that is a style, right? And it's not the right or wrong answer. There's no data to support that, because other people would argue that it's not our job. It's time we make people uncomfortable. It's time that we aren't flexing or are flexible and are allowing certain viewpoints to be at the table. But I think the way I address it is very non-accusatory. I show them the data, right? The argument is compelling, right? Anyone who comes into our society as a foreigner can look at this data and they can see there's a problem, right? It is And I think the most people who are indifferent or seemingly against the idea of expanding upon our education into racial disparities, health equity, are most likely not exposed. Our society in America is very segregated. And so I'd argue that a lot of these people will have and this is, and I'll be a little bit political, and we look at Trump versus Joe Biden, and I'm sure you guys are aghast at how it could be so varying in different viewpoints in the way this is looked at. But I'd argue that a lot of the people who support Trump probably do not have access to the minority populations or the marginalized populations that those policies could potentially be harming, right? Or that not necessarily policies, but the thoughts, the language and everything. And I would say that that segregation is not specifically their fault. And I always like to say that their difference, the lack of exposure to the statistics behind Native Americans. Our country is horrifyingly bad at on our statistics in higher education. And I, who's been to every interview to every institution, I think I might have seen 2 or 3 Native American students in my entire educational career. And so, but for someone to want to remove the affirmative action that allowed those students to get there, could not possibly understand that only 3 students in this giant amount of studying, right? And so I think if you bring the data to them, it usually can support itself, right? And try to make it a little more non-accusatory. And I'd also just adhere that there's empathy gaps. There's huge empathy gaps, and we have a problem with it. And try and make sure that you're highlighting the indifference to a problem, highlighting the gap in the empathy as a problem if you're having this discussion. As far as race being a social construct, I mean, people have been trying to get rid of race here in the United States for a couple of decades, and only when it's convenient for them. It is a social construct, and that's why I specifically brought up the study in 2016 where medical students were going by different colloquial misconceptions that African Americans have thicker nerve endings. And I really like Kamara Phillips Jones. I encourage you guys to read it. Her description that it is important, but not by a biological construct, but to measure. It's very important to highlight race in the United States because it's measuring the impact of society on us, right? Like all of us are exposed to it. You can't possibly turn on TV without being exposed to these things. And so that would be hopefully that answered your question. I would say bring the data forward and try and do it to keep everyone at the table. I think we're having a really difficult time with keeping people at the table.
Thanks.
Thank you.
And I would point out something interesting in that conversation that I, as a more recent immigrant to Canada, didn't realize was a difference between the two countries. And we talked about this briefly, is that I didn't realize that there wasn't race data in being tracked by public health and that kind of thing in Ontario. I heard about it as we were discussing COVID and thought it was specific to that. So it would be kind of hard. How do you start the conversations when we're not collecting the race data? But interesting difference. And I believe Mark Walton also had a question, and there were 1 or 2 more after.
I just love your talk. It's just amazing, and thanks so much. We've in Canada, we are far from perfect, and we have a relatively sordid past of systemic racism and concerns with our Indigenous communities, and what has been called a cultural genocide. So we are far from flawed. And there's also some evidence that slavery was present in Canada. So we have to own some of that. So that sort of brings up the systemic racism that is really, it's omnipresent. And I think the great impact has been the fact that everybody has a cell phone. And we've now started seeing videos of what others have been aware of for many, many decades. And it's become really something that we have to wrestle with inappropriately. So certain Black Lives Matter and all the horrible videos, and especially our own Joyce Echequan, Indigenous woman that was treated horribly in racist comments in Quebec hospital. So I think we've got a lot of work to do. My question is just about affirmative action and whether it has been helpful, or because it's been in place for quite a few decades, and whether it has had the impact and the results that when it started. So I would be just interested in your comments on that.
Yeah, and this is fascinating. It's a contentious subject. We've just had a 2019 Supreme Court case, specifically at Harvard, go through, and fortunately, based on my belief on the matter, fortunately, affirmative action was still maintained. The reality is the argument against it would be that it's clearly not helping. You can look at the last 20 years. There's underrepresented minorities here. They're underrepresented. We're trying to reach at least population parity, or at least move toward that direction. That by removing a policy that includes or increases the amount would be even more devastating. It's hard to make the argument that it's beneficial or that we should remove it because it's not helpful enough. A similar analogy I'd make is to welfare. Like 88% of kids who grow up on welfare are adults on welfare in our country. And that's our social net. But one would argue that welfare begets children who are going to be on welfare. But I'd argue that if not for welfare, there would be hungry kids, right? They won't make it to that point. And I'd argue the same with affirmative action, that like removing the one thing that's helping increase this, even if it's not the most helpful thing, even if it hasn't been perfect, even if there's flaws to it, it's pretty much difficult to remove that if our numbers are still so low. And it's most of the time, the arguments against its utility is that a rich kid is getting in, or an immigrant who might not necessarily be somebody who, right? And I certainly agree that if you're having an argument that says affirmative action is benefiting the middle class African-American student, the immigrant African-American student, as opposed to those who are inner city, the ones who are most likely susceptible to these biases and structural racism, I would flatter that argument. We can potentially look at ways to change this. But I would argue that the imagery of having a student there, the complexity of biases of based association to race, that would be still beneficial to the African-American race in whole to have an increase inside this population. And they've tried to do metrics in which they've changed it. Like, for example, Texas, our biggest southern state, has a top 10% rule. It's the top 10% of every high school gets guaranteed admission into their flagship school. And that was also brought forth to the Supreme Court, right? And that's basically because of segregation was a proxy for affirmative action, that the top 10% of every school means top 10% of schools that were majority Black would also have acceptance. And that was Abigail Fisher 2016 Supreme Court case. And the point is that even when we argue and try and change the race to as a proxy for some of these other constructs that we generally want, we still have a backlash, and it's still a fight. It is a difficult conversation, and I would say it's most difficult when talking to other minority students, such as Asian Americans, other immigrants, who are likely to get be harmed the most out of it, right? And so, and I understand it's a complex conversation, and I think that's the way people should look into it. I don't think people should look into this without understanding the other side of the coin, and that it's complex and some people are suffering from it. But still, I'd bring forth that there's been chances and attempts to change it simply from race to like better include the demographics we're looking at, like the top 10% rule in Texas. And there's still backlash. There's a ton of backlash and indifference to this plight. And so I always start these conversations with the data, with the statistics, with the idea of what an underrepresented minority is as opposed to a minority, and try and make sure that the conversation stays non-accusatory and that I'm seeing the other side. I go into these conversations listening not to make my own viewpoint, but just to hear how somebody could have such a different viewpoint when it seems so obvious to me that this is something that we need. And I try my best with that.